All right. Hello and welcome, everybody. My name is Amanda Schellinger, and I'm with the National Kidney Foundation of Wisconsin. Today's topic is supporting transplant as a caregiver, strategies to avoid burnout and promote well-being. A special thank you to the UW Health Transplant Center for their support in putting this webinar on today. Before we dive in, I just have a couple of housekeeping announcements. This presentation is being recorded and the recording will be made available on the NKF Wisconsin website within the next few weeks. Please note, all attendees will remain muted and off camera for the duration of this event. This helps to avoid any disruptions to the presentation. If you have any questions, please go ahead and click the Q&A tab at the top of your screen. It'll pop up a window on the right-hand side of the screen, and you can go ahead and enter any questions there. We will address any of our questions at the end of today's presentation. Lastly, I just want to take a few moments to share some information about other upcoming NKF Wisconsin events. So in March, on Thursday, March 14th, 2024, we will be holding our Spotlight on Life Gala. Cheers to more healthy years. Hoping any of you who are interested can join us for that. For professionals, we'll hold our Renal Professional Education Conference. That will be in November 2024, and that will be held in Madison, Wisconsin. And then for patients, similar to this webinar, we'll be holding two more webinars, one in February on hypertension and kidney health, and then another on April 17th on understanding living donation. So you can find any of those events or more information about those events at kidneywi.org. Okay, with that, I will turn it over to Dr. Kari Meyer, who's today's presenter, and she can go ahead and begin today's presentation. Thank you, Kari.
All right, thank you so much for that introduction. As shared, my name is Dr. Kari Meyer. I currently work with UW Health, and I'm honored to be here this evening to talk to you all about what the role of a caregiver is and how we can best support this role, especially throughout the donation process. So this evening, I'm hoping to cover these areas, specifically in summarizing or defining what it is to be a caregiver, what are some of the common experiences of being a caregiver, as well as some expectations of the role and that process along the way. And then this will lend to the experience of burnout, which I also want to differentiate between everyday stressors. And this will be done through navigating common symptoms, what leads to burnout, and just what individuals commonly endorse, both within a general role as well as within a caregiver role. Then we'll be talking about burnout prevention, some coping strategies, and how we can promote well-being. This will then conclude with just a review of the areas discussed here and otherwise, as well as time for some questions that you all may have. So the caregiver role. In large part, it is just providing physical or medical support for individuals that have specific medical needs. This can also include supporting individuals' emotional, spiritual, and financial well-being, as well as helping them plan for the future and what that might look like, given any medical needs or any of the reasons listed here. Caregiving can include activities of daily living, which include providing care for individuals' bathing needs, toileting needs, food needs, things that are specific to that personal functioning. It can also include instrumental activities of daily life, which are kind of a step beyond that. And it includes pieces like the financial pieces and the information listed here, like medication support, scheduling appointments, those pieces that aren't crucial to specific medical or medication management, but again, just that step beyond housekeeping, even management of rides, transportation, like I said, again, just that step beyond that medical specific piece. Within the caregiver role too, individuals can have various training that within their background in addressing these needs. Some individuals are what we call on the fly, so they're learning as they go. Other individuals will have some pre-existing training. This can range from being a parent, right? Even just learning how to bathe someone within a parent role and then transferring that to a different loved one, versus having no experience, right? Someone just jumping in because they want to provide support for someone who's important to them, or a neighbor or a loved one. It can also vary for some individuals who are compensated for the role as a caregiver versus somebody who does it just, again, as a family member, as a loved one. I like to share though that whether someone is compensated, has this training, or even has professional medical training, each individual who is a caregiver is completely valid, and burnout can be experienced across any of these types of roles that were shared. I then want to elaborate a little bit further about how caring for kidney disease or someone for transplant is a little bit different from a traditional caregiver role. Like I said, being a parent can even be listed as being a caregiver, right? For all sorts of reasons. We also have caregivers for individuals of the elderly or aging population, individuals with different illnesses such as dementias. But there's a different level of care that's needed for individuals going through kidney disease or going for transplant. And I want to highlight these because, like I said, caregivers come in all different shapes and sizes, all different levels of training and understanding. And with kidney disease, there's a little bit more specific care that underlines that concern. Again, this can include the transportation piece to hemodialysis, management of polypharmacy, or what is known as managing symptoms that are a result of another medical treatment or medication that is taken or given, as well as managing any immunosuppressant medications and injections. It can also look different in the caregiver role here because there may be more coaching, helping individuals stay motivated in their care, helping your person you care for kind of come to terms with any news or changes, which might not be seen in other roles or individuals who need caregiving support. Other pieces can be a little bit more intimate, like changing catheters, as well as any nutritional needs. There's so much culture that's within food, right? So we even think about meal planning and how that can change with nutritional needs here with kidney disease, and how that can even become a difference in one's relationship and how you can connect to somebody via food. Another thing that's pretty unique is this individual having to work within complex medical systems, having to talk with different providers, having to understand medical lingo. And again, it's that step different from other presentations or other illnesses. And so, like I said in the previous slide, every role of caregiving is valid with training or not, if you're learning it on the fly. And I want to highlight these areas because some of our caregivers become so accustomed to navigating these areas that they often forget how much they've learned along the way, or why something may feel stressful now that wasn't in the past, or vice versa. And so through highlighting these needs, we can help those who are caregivers understand their expertise in the support that they are providing their loved one. Additional areas that have been endorsed as stressful for those with kidney disease or awaiting kidney transplant is the age of the individual that is diagnosed or going through the concern. Again, that financial piece, what does insurance cover, what other supports are available, how chronic or acute symptoms are that are being experienced. And it's also been found that there's more burnout in caregivers who are providing that physical care. Again, it's a bit of a deviation from other caregiving roles, but these are areas through research over and over that have been identified as particularly impactful or thus leading to additional stress. I like to really highlight this again because we want to advocate for our caregivers that they have become an expert in this, that they are providing a beautiful standard of care, and that it's a lot that they're managing. And so through, again, identifying and summarizing this experience, it helps them understand what it is that they're doing, when sometimes it can feel like they're not contributing in any way at all. And so this brings me again to why is it important to recognize this in our caregivers? Well, by having your expertise and knowing what, how, and why, you can understand a bit more of like what you're navigating, what you're going through as a caregiver, what stresses or loves you might have for the role. And this can also help you in being informed. One piece within the caregiver role, it's really understanding what your role is and also coincidentally figuring out what it isn't and how you can navigate, make sure you have the best research and training going into your role so that you know you're doing as best of a job as possible, or delegating when there's pieces that you aren't comfortable working with. And that's where it's also going to knowing what is or is not your responsibility. As a caregiver, you're giving your time and space to provide support for somebody else. And so through understanding what it actually means to be a caregiver, you can have a better expectation on what it is for you and what you want to do to provide that love and support for somebody else. Or again, if you can't do that, and how you can make sure the person you are caring for still gets that type of support should they need it. So as I continue to navigate this presentation and talking about burnout and stress and other types of worries that can come up, I want you to keep these 3 areas in mind. Why is the caregiver role important? How are you being informed of the caregiver role? And knowing what is or isn't your responsibility. So now going to burnout. So burnout is defined as a state of physical, emotional, and mental exhaustion. It is often said in lay terms, what we hear in everyday conversation is feeling tired, stressed, withdrawn, anxious, or depressed. Individuals can feel burned out in any aspect of their lives. It isn't just specific to caregiving. You feel burned out related to childcare needs. You can even feel burned out to your own nutritional needs, your own goals. And it can come and go, wax or wane. It can come in waves. But for being burnt out, it is, again, just these symptoms at large and that exhaustion. So some of you may be looking at this slide and being like, well, Kari, I have these all the time. How do I know I'm burnt out or whether this is a different kind of stress? And so I want to jump into that too. Oftentimes when we think of the word stress, we think of it as bad. We think of it as taxing. We think of it as overwhelming, which sure, it can have that type of concern with it. But there's really 2 different types of stress when we break it down. We have eustress, which is known as the good stress, the pieces that motivate us, the things that make us feel good. I often even think of my own work, like what is motivating me to do better? What is motivating me to do this research? Like sometimes I can have overreactive emotions. I can be upset, I can be anxious, but there's something motivating me to continue to pursue it. For distress or bad stress, if we can call it, is when it becomes to a point of being overengaged or too much for someone to handle. And this either type of eustress or distress can have overactive emotions. Again, we're talking about that motivation piece. But with the distress, it can be a lack of motivation, not wanting to attend, feeling like you need a break. This differs from burnout because with that emotion piece, the emotions are no longer overactive. Instead, they're muted. I like to say they're blunted. And so one way to identify this is if you are thinking of your ability to engage in something and you don't have a reaction for something that you maybe once had. Within mental health, one way I like to explain this is when we're talking about even like on the far end, like suicidality. Even with this training, if my heart doesn't go to my butt when I think about suicide, that means I'm burnt out, right? I'm not having that visceral reaction. I'm not having that moment that this is crucial or this needs my attention. I'm having that muted emotional expression. Versus with stress, you can feel that activation. You can feel that come up for you. You can feel that it's still important. And so that's the defining line in navigating this, working with your caregiver to figure out how are they responding to, how are they attending to, are they aware of their emotions, are they blunted in nature, or how are they expressing them? Like I said, burnout can happen for all sorts of reasons, for all different types of circumstances. But it has been mostly noted and researched within the caregiver realm. 60% of caregivers have endorsed having burnout in some part of their experience. Again, using the lay terms and understanding the language that people have used to identify what burnout is, it includes these listed here, but in short, this withdrawal. So feeling secluded or alone in their experience of providing care for someone else, feelings of hopelessness or feelings of guilt. So again, feeling as if that they're doing something wrong or bad or feeling stuck. Some individuals can even express irritability. So this can be frustration, anger, having a shortened temper, realizing they're reacting more quickly than otherwise. And the last one is fear. So anxiety or worry for the future. And these ones differ again from traditional burnout and having that tiredness, feeling overwhelmed. In that for caregivers, they tend to explain their burnout with a little bit more of intensity. Again, not frequency, so they're not saying these emotions happen as often, but the words they tend to use when explaining how they were feeling before being burnt out and throughout the course is specific and again, more intense, that withdrawal, hopelessness, irritability. And so it's important to recognize that difference because if we're talking with a caregiver, we might hear these words more often than them just feeling tired, right? And we don't want to over pathologize their experience either, meaning that we don't want to say that it's a mental health issue for why they're experiencing this. Instead, it's validating how they're feeling, figuring out if it is burnout, and the support that is available for them then. So with that in mind and how the language is different with caregiver burnout, I want to check in on the aspects and roles that have been identified to most likely contribute to this kind of burnout. So research also suggests that caregiver burnout is most likely to occur for individuals who have role confusion. So again, if we revisit the information that I opened with, it's understanding what the caregiver role is and isn't. So knowing your role, being informed on that. And for individuals who might have some confusion over what's expected of them versus what's traditional, or maybe it's a change in their role because of a change of medical requirements for their loved one, right? So they may feel lost in what to actually navigate, what they can delegate, and what is their sole responsibility for taking on the caregiver role. This ties in with the second point, with the varied expectations. So again, these expectations can come from loved ones, right? A loved one going to a caregiver and be like, I would do that different, right? Well, it's not up for that other loved one to determine. It's up to the caregiver to determine because they're the ones providing that support. But hearing that from someone they trust and value, it can also lead to that role confusion. Are they doing the job right? Right? Are they following suit and what's important to them in their role? And so again, having that clear expectation and understanding of what your role is. Another piece is a lack of control. So again, with the medical piece and having so many recommendations thrown at their loved one who's going through kidney care or any transport piece, it might feel difficult for them to realize what it is that they're actually doing to contribute to that person's well-being, right? Are they actually helping? What could be hurting? What could they be doing different? And so this lack of control, as it's defined, can also lead to that burnout experience, always feeling like they're trying to catch up to what's going on. The other piece is too many responsibilities. Like I shared in a couple of slides back, there's so many things unique to kidney disease, right? The medication, the polypharm, injections, catheter use, nutrition use, right? And so how are individuals attending to all these areas, especially, like I said, all caregivers can come in different shapes and sizes with different experiences. So when might too many responsibilities be put on them? Are they aware of what they can delegate? Do they have access to those resources for delegating? And the last piece is not realizing burnout is happening. So like I said before, like when I listed those burnout symptoms, it can be really easy to be like, well, like I said, Kari, these happen to me all the time, right? So then normalizing this experience without knowing how the experience is causing that blunt or muted emotional experience. And so that burnout then can become cyclic, right? Well, this is normal. And then something happens where they feel more hopeless or concerned because of a medication change and they can feel more burnt out. But then they try to normalize that as part of their experience of this is what it means to be a caregiver for someone with kidney disease or going through transplant. And so it's also important to help our caregivers recognize what is burnout, when is it happening, and that it's not their fault that they're feeling burnt out either. Another piece that's important in helping our caregivers understand when burnout is happening is that we can prevent some of these long-term impacts of burnout. And so with that, research suggests that some of the long-term concerns of burnout is having concerns of anxiety, depression, and decreased resilience. And so I first want to check in with this resilience piece, which means somebody's ability to work through adverse or difficult concerns or things that arise. And so when we're reflecting on that withdrawal, hopelessness, feeling overwhelmed, feeling fatigued, right? I like to picture it or explain it to individuals. With caregiving, sometimes it can feel like you're walking up a mountain with a backpack of bricks. But that backpack is also filled with like nutrient bars and water and things you need to get up that mountain. And if we're continuously struggling to get up that mountain and that's leading to burnout, and we're still using all of our good tools like water, nutrition, granola, or resilience skills, we can deplete that source. And it can lead to the feelings of being overwhelmed, fearful, hopeless, overtaking or defining our experience. And that's what those mental health diagnoses mean. It's when those traits define our experience more often than our regular functioning. In addition to the emotional distress, it can also lead to a delay in physical care. And what I mean by this is individuals who are caregivers for those with kidney disease are often communicating continuously with medical needs. They're associated with my chart. They're sending messages to doctors. They're helping individuals get to appointments, different lab work, right? That can become, in a way, their full-time job. And so when they have free time for themselves, they may be less likely to go and seek that own physical care, any preventative care for themselves, because it's a world and role they're already living in, right? So making that distance for themselves. And so when they don't seek this preventative checkup, it can lead to early diagnosis or awareness into their own physical needs, making it difficult for them to care for themselves in the way that they need. So again, I'm not saying that this is cause and effect, or people who have burnout will have these concerns. Again, I bring this up because I think just being in a caring role, being supportive of our caregivers, and even if you're a caregiver yourself, recognizing when you're meeting these limits or when burnout might be sitting in. So then you can also make time and attention for you too. I like to say to caregivers that you can't pour from an empty cup, right? You can't give what you don't have. Your care is also only as good as the care you give yourself, right? So in recognizing before this can become very distressing and overwhelming, like this slide puts it, you're able to instead focus on what you need as a caregiver and make these initial steps so that this cycle and connection can be broken. So this then takes me to the burnout prevention portion. And I'll also take some time to talk through, if you already are burnt out, how to work that as well, right? So it's going to look a little bit different, but for the prevention piece, we're going to look at these 4 pieces just out of the get-go, right? So find somebody that you trust. Specifically, what I mean for this is somebody that you can go to and feel comfortable to be like, I need to talk, or I need to problem solve, right? Making space for yourself with this person so you can navigate the needs and wants that you have, not just for the person you're caring for. The other piece is setting realistic goals. Like I said, a lot of pieces that contribute to caregiver burnout is not knowing your expectations of the role, having some role confusion, and also some variances in when things might become too much and how you might be able to delegate some of those responsibilities. So in each step, if you can set realistic goals, it might help you work through what you're doing to care for your loved one. It also can help you work through problem solving when things come up. If there's things that you feel like you don't have training for, how can you get that training, right? It can just help you kind of lay the map for what's coming up next. It also helps you identify when things you can't do. Like for myself, I couldn't really do much with blood, and that's something I know of me, right? And so I'm able to still be a caregiver and a role in a way that's comfortable for me and is realistic for me. This realistic goal piece also can be helpful in identifying what you want to learn more about, right? What other types of care are available? Maybe this individual that you're caring for doesn't only need physical support, but could use just some social guidance, or maybe he wants to connect in a spiritual and religious way. What could that look like in your role as a caregiver? Another piece, and this is where it might become a little bit redundant, taking care of yourself. Again, you can't pour from an empty cup. So what are you doing to make that time and space for you? And we'll talk a little bit about that later too. So now I want to take the skills that we're talking about with having that space for you, setting realistic goals, knowing your role, but actually seeing what it looks like in practice. And so the pieces, the 5 points I'm going to stick to here is how you can use communication, organization, tracking progress, again, recognizing what you can provide, and that self-care piece throughout various stages of the transplant. So pre-donation. Again, this can look so various for different individuals who you're caring for. You might have some individuals who have more bodily needs, more, again, like I said, those ADLs, focusing on your physical care, showering, day-to-day routine pieces. Some of it might be more that the person you're caring for is more independent in those areas, but might need more support in managing different appointments coming up, working with transplant coordinators, working with other areas of support. So it's really like narrowing in on what support is specific and in need from the person you're caring for. This can include writing down your questions, Another piece that's nice with my chart, just emailing and messaging your questions right away so that you're not holding on to all this information. By also making your questions known earlier when you do go to appointments, it's helpful for your provider to get any additional information or maybe do a warm handoff and getting another provider in the room with you so you can have that information brought to you more quickly. Other things that can be helpful is putting together lists of important information, such as organizing medical history and having that stuff compiled. So if all of a sudden you get a call and you need to have that information right away, you're reducing that stress in the moment of then having to find it, return a call, get in touch with the provider, right? Having that information organized right there. So then the pre-donation piece, I really want to focus on, have your caregiver focus on that communication and staying organized. Some progress that can be tracked is how well is the individual attending to any pre-donation needs? How are they doing with any appointments, follow-up, right? It's a little bit different in this point. And then within this role too, again, resting and recovering, figuring out for the caregiver what's important to them, what supports and coping do they need, and again, using supports for yourself too. Now moving into the preparing for surgery piece. One common piece that I hear from this point is, okay, we found out they're having surgery. They're going to have a new kidney. What can the caregiver do in that point? Because some of that care is immediately out of their hands. One crucial piece is organizing a communication tree. I really like to say, is it going to be that one caregiver who's doing texts, phone calls to share the information, share updates, or can that caregiver delegate that information and send it to one person and then they email so many people and friends or family? And how is that information being shared? So again, planning that ahead of time as well. And then also talking with your loved one to figure out what support might be most helpful for them and how that might change. And then after surgery and transplant, the common area that I hear in this portion of care is surgery and transplant always being looked at as the finish line. So I like to equate it as like a marathon, right? Like individuals are training to run that entire marathon. They're taking care of their physical health. They're making sure they're hydrated. Their muscles are getting what's needed. But once they hit that finish line, it doesn't stop there. The care keeps going. The individuals still need to recover after the marathon. They might even need to do more recovery and more care for their body and their self after the hypothetical marathon. And so it's reminding the caregivers that, yeah, like they helped their loved one get to this point and it still keeps going. So similarly, how are you communicating recovery needs? Is the caregiver also taking that time and space while their loved one is in the hospital to refocus on themselves, planning for next steps, and also planning and caring for their own emotional well-being? This can also include, again, taking notes, tracking progress, figuring out next steps and what care looks like, and working with those medical providers to figure out next steps and what that looks like for your loved one. Other areas that I like to recommend with burnout include maximizing your time. So I'm going to backtrack a second. These points here, it's not that they fit into any specific area of the pre-donation, preparing for surgery, or after surgery. Instead, these are just common concerns that I hear from caregivers regarding burnout. And so one piece I like to say to caregivers is, how are you maximizing your time? And what I mean by your time is time that is of the caregivers, not time that they're giving to somebody else. And a really nice example with this is if they're driving their loved one to hemodialysis, which for many, it can be a very lengthy appointment, right? So how are you splitting that time if you're able, either from sitting bedside to making it more of a time for you, right? Getting any grocery shopping done, picking up any needs, checking with other providers, or even doing some self-care, talking with a friend, right? So utilizing that time and space when you have it, when your loved one is in the care of somebody else. With this, I also encourage individuals to minimize the time they're talking about their caregiver role. So when individuals do have that time for themselves, how are they taking that time to not only be retelling everything they're doing or only talking about the person they're caring for, right? How are they still making that time and connecting with others in a meaningful way for them? I always say, not always talking about work. And so what I encourage individuals to do, especially if they are meeting with family and loved ones, and they're like, oh, how is so-and-so doing? Literally set a timer. on your phone and be like, okay, we will talk about this loved one or this friend for 5 minutes. When that timer goes off, we're done and we're going to enjoy our lunch, or we're going to go and see this movie, or we're going to go and do whatever activity is they are participating in. So they're still making time and space to talk about their loved one, but they're also prioritizing their time and space too. This next point, again, is a little redundant for like knowing your limits. What care can you provide? So I'll often hear caregivers even come in and be like, I've done this injection for so long, or I've been really helping or struggling with this use of this catheter, right? And so I'll talk to them and be like, what you're feeling is valid, and they have the right to change their mind. The caregiver has the right that even if they have that training and they have that research, if that isn't the care that they want to give their loved one, they can work and try to find a different way on maybe how that care can be given. Again, delegating it. Maybe there's somebody else who's more comfortable with it in their family, who has more training with it, right? Same point, some individuals in processing that as a concern, they realize like, oh, I actually don't mind giving that care. I'm fearful if I'm doing it right. Right. So kind of processing that line with them. Is it something that they're getting burnt out on doing the task? Or maybe through that process, they realize I'm actually not as informed as I want to be. So helping that caregiver get that information and that teaching and that learning so that they can be more confident in that skill. The last piece I often talk to caregivers about is what it means for them to accept help. And the way I navigate this is saying for some caregivers, they're forced in the role, just depending if they're a parent or if there's others aren't around or if it's more rural area. But for some, they'll say even though it was forced on them, that they have some level of them that enjoy it, that there's a reason they continue to do it, and that it's important to them and something they value. And so I remind the caregiver that when they themselves then accept help, they're allowing somebody else to still feel that same self-fulfillment for helping them, right? So I explain it as a way of you are consenting for somebody else to help you. And in a really beautiful way, you get to teach them the help that you need. You don't have to let them assume what you need or how they can take care of you, but you can tell them like, I'm really struggling with X and Y could be helpful. Right. And so, again, reminding the caregiver what it means to accept help, how it may vary from their understanding of what it means to be a caregiver, but then again, how they're also sharing that caregiving role with somebody else by accepting help themselves. And also reminding them that it's okay to ask for help. The next part of the presentation, I would like to focus more on the therapy-informed interventions that are utilized to help individuals with burnout. And I share this not to be a therapist to those who are watching, but that these are clear and concise steps over the next few slides that can help individuals work through distress or work through concerns. And so I like to share them with the public because it can make it a little bit easier to navigate maybe some more difficult concerns, or when distress may be more prevalent, or maybe when burnout is on the rise. And so when we take a look at problem-solving therapy, it is defining what the concern is at hand and different steps and ways to work through it. It's a pretty formal way to look at the problem at hand, but the way that it's broken down, it can help the caregiver and their loved one, or a caregiver and a family member, or caregivers together figure out different approaches to a situation, especially when burnout may be on the rise. So here I have the example of your loved one is maybe feeling a lack of autonomy, or maybe they're struggling with the level of care that they need. And so one story that I hear over and over is if we're looking at bathing needs, if somebody is feeling very ill and they can't take care of themselves and need help with bathing. And they're also feeling bad because this is something that maybe given their age, or maybe given something that's important to them, they feel like they should be able to do on their own. And so sometimes it doesn't have to be communicated directly to the individual you're caring for, but instead, like I said, a caregiver seeking support or caregivers working together. So the first step is defining what the problem is. And here it's pretty straightforward with the example that the individual is feeling a lack of autonomy with it showering. So the next step is, well, what would the goals want to be? We want to help the individual feel supported, right? We want to help them feel heard. We also want to work in alignment with their value and what's important to them. So helping them feel autonomous in that showering role, not being as dependent on others. So then if we go to the next one, number 3, it's going to be, all right, what other solutions are available instead of us just having them go in the shower and the caregiver dictating every step, right? So it would be the caregiver and somebody else working through different options. Well, maybe you can't change the showering process because of physical abilities. So maybe you can just decrease how often you're having them go into that kind of situation that's making them feel less autonomous. So maybe have more bedside showers or using wipes as appropriate, right? And then figuring out a routine for when a full shower might be needed. That's one solution. Another solution could be having the individual pick the time of day, the order they'll shower, having them participate in turning the water on, finding what products they want to use, having them make those decisions for themselves in the moment so they have some autonomy over their needs and choosing what's important to them and having their say in the moment. Other solutions can be having a different caregiver come in and do the task, right? There can be so many different solutions for so many different needs. The next step, number 4, is going to be working through, okay, how do we try these different solutions? Which one might be best? Will it work in every situation? When might we not be able to use a specific approach, right? So I like to think of number 4 as challenging ways to implement number 3, right? All the ideas we discussed, or finding ways that would be the most feasible or easiest to implement those ideas. Step 5 is evaluating solutions. Which one might be the best to try first? How can we move through them? And how will we know when it isn't working? Right, so like I said, it's a little bit more formal than we tend to think of problem solving. But again, it's letting us know how we can be prepared when things feel different or feel off, which can also mitigate burnout because you're having that open communication. You're understanding when things might have to change, and it isn't resulting from distress. It's being proactive and identifying those pieces ahead of time. And then number 6, reviewing the outcome. This one I would say, like, you could put in or not if you're using it to talk, because most of the time the review of the outcome is, well, it worked, let's keep doing it. Right? You very rarely have to sit down and rewrite all these processes out or talk through it. Instead, I like to say the pieces where it might be more prevalent is when you tried to practice an idea and it didn't work, right? So then how can you revisit number 4 and number 5 to figure out what you'll do next? Again, these steps could be used for something big and helping somebody feel more autonomous. It can be used in also delegating who should we have in our communication tree, who will be helpful in sharing this information, right? It can also be who's going to talk to this provider, who's going to do this ride, right? When things can often become very filled because life continues when we're planning still as a caregiver. Implementing these steps so that you can have different solutions, not only having that one and done approach that, well, that didn't work, and then feeling stuck and feeling more stressed in the moment. So I like to use problem solving as how are you planning ahead and being proactive, because that, again, will also help you be less stressed in the moment. Another area I like to use within therapy settings or meeting one-on-one with caregivers is talking about motivation and perspective taking. So in caregiving, especially if it's long-term across all different areas of transplant or kidney care, it can become very easy to become or feeling lost in moments. So helping individuals understand, well, what's motivating you to provide this care? So again, why is this caregiver role important to the person at hand? And this can really help mitigate those early steps of burnout when individuals recognize that fatigue and being overwhelmed, helping remind them why they're doing this in the first place. Because like I said, it can feel really lost if all of a sudden health declines and you're feeling like they don't have control of pieces, right? Reminding them what they do have control of, what they are doing. And again, that motivation to keep going, what their goals are. It can also become easy to feel stuck when the finish line seems so far into the future. So instead, having individuals change their perspective, instead of comparing themselves to something way in the future that they might not even be able to envision for themselves because it's so far away, to instead reflect on, well, where did this start from? This is especially helpful for individuals who are caregivers on the fly, because if they were learning so much at first to catch up, they can often forget how much learning they actually did and the expert they are in their experience. So I like to have caregivers think about where they started, recognize what they learned, and then helping them use that to form the realistic goals, to figure out how they can communicate their needs and how they can make these next steps easier, and also reminding them that there's additional supports and learning available if needed. So again, where are they putting their binoculars and their lens? Are they focusing only on the future, which again is hard for them to visualize? Are they only focusing on the past because maybe the health of their loved one was better in the past, right? So bringing it to the today. And again, this coincides with the next point, taking it a day at a time approach. Sometimes medicine and care plans can be so wonky, so different. Individuals can react to medications on various timelines or different treatments. And so recognizing that this day may be different than what was anticipated or expected, but you're taking it a day at a time and figuring out what your loved one's needs are for that day. The last piece is shifting your focus to self-care. So how can an individual utilize any times and feeling lost to take care of their own needs? How can they even practice this self-care with their loved one, right? I even, a story comes to mind when thinking of this about an individual who loved doing their nails. And so they found more, it was like sensitivity products and different nail products that their loved one could have throughout their process. And they would just do spa days together. So in them providing self-care for themselves, they also were able to connect to their loved one in a different way, not just as their caregiver. So again, how are you shifting your focus to your own needs? How might there be overlap? Or when might the caregiver need to make distance in that? And this brings me to the piece of promoting well-being, promoting that resilience. How are you going to have that self-care? And I share this not to say that burnout is the absence of well-being, that being stressed is the absence of well-being. Instead, I mean that in the sense that having health and well-being and promoting resilience and coping is finding the pieces in balance. And so what I like to focus on in the therapy realm again is the 8 dimensions of wellness. So what are individuals doing in these domains to promote their health and wellness? So to run through them quickly, physical health is when we're caring for the nutritional needs, we're caring for our bodily needs, also just taking breaks when we need it, right? So really honing in on that body connection. The intellectual piece, we're thinking more of the mind, more of that cognitive piece. How are individuals engaging in a meaningful way with thought? I think some of this is even just playing favorite music, right? Music can elicit so many different emotions. It can help relax us. It can help energize us. Other pieces are like doing puzzles, right? Being engaged in a hobby that you enjoy. What are you doing to engage your mind in what you're doing, not just being mindless? The example I like to give with this is who's just sitting and scrolling on like a TikTok or on YouTube shorts, right? When it can just be mindless, passive. Sometimes that is what we need to fill our time. But when are we using that instead of engaging something to help us feel more like ourselves, building that resiliency and coping with hardship? Social well-being is connecting with individuals that are important to us. So going back to that recommendation of having someone you can trust and being able to connect with them in a real way. I also remind people of, again, setting that timer to make sure you aren't spending too much time in your social life talking about your role. It's like we talk about work, right? If you're only talking about work during your free time, well, you're probably still working. Your mind hasn't shut off. So how are you using that social time in a purposeful way? Spiritual can also be religious. It can also be just someone's values and how they're living in accordance with those. So it doesn't mean just making time for church or prayer. It can be how are you also living in accordance with your values in a meaningful way, and how are you making that time? Vocational or occupational. If an individual is working and a caregiver, sometimes it can be helpful to discuss how the caregiving role is still work. So then we'd be like, oh no, I'm off the clock. This isn't work for me. Letting the caregiver know, like, you're still working. It looks a little bit different from your occupation, but you're still working. And so what do boundaries look like? How are individuals navigating their schedule? And are they planning breaks for themselves? To that same point, I mentioned being a caregiver can be very motivating for somebody. It can be very rewarding, right? So helping them recognize why they're doing this role, what's important to them about it, and not just focusing on the negative aspects that can be associated with a vocational, occupational, or the caregiving role. financial well-being. So this kind of crosses in with some of the stressors we talked about earlier on, but what are individuals doing to help with their financial health or their financial health? Are they doing only for the caregiver? So they're not focusing on their own needs, right? Or maybe their financial needs are being impacted by the caregiving role. So figuring out if individuals need support in this area. And the environmental piece, most people think like, well, do I need to go hug a tree, Kari? And I'm like, not quite, unless trees are a value of yours. Instead, I like to say with your environmental health, how are you setting up your environment to be conducive to your needs? And what I mean by that is maybe journaling is important to you. So how are you setting up your room so you can access your journal easily during the day, have that purposeful time, and then go on with your day? Maybe your hobby is planting, right? How can you plan financially and emotionally and socially to go get those products, bring them to your home, and set up time for that? So you're setting up your environment to help lead to success so that you can participate in various areas here in the 8 dimensions of health. So as I was going through these, you may have noticed there's quite a bit of overlap in it. And that's where I like to talk with caregivers by focusing on one of these areas. It's like a domino effect. You're probably impacting so many more areas and promoting well-being and again, balance, because coping and well-being and wellness, it isn't all or none. It's what you need on that day and what you can do to take care of you. And so that's my note on self-care. That self-care isn't always just going and taking that bubble bath, right? It's not how we picture self-care from social media or how it's been taught to us that when you have self-care, it needs to be perfect or it needs to be set up for you. Self-care can be making time to do your laundry so that you have clean clothes when you go into your work week or when you have clean clothes to go and be a caregiver. Self-care is also getting the grocery shopping done or ordering groceries to be picked up, right? So sometimes it's reminding our caregivers that self-care can look like whatever it needs to be, especially in these 8 domains. And it doesn't need to be this big, extravagant thing for them to participate in it. It can be nice for them to make that time for themselves, especially if it's something they need or value, but it doesn't only need to be that, and that you can fit in coping and regulation throughout the day too. These areas also promote, like I said, that resiliency. So we're going to go back to climbing up that mountain with the backpack, right? When you make time for this, you're adding more water bottles, you're adding more granola to your backpack, you're making it so you have more of those resources readily available so that you're more likely to succeed and work through any adverse concerns or experiences. So in summary, in talking today, I started going through a caregiver role, what it is, different things that can be expected, because again, I wanted to define or summarize what individuals might be going through, as well as maybe things they're anticipating or fears they may have about it. But ultimately I did that because I want caregivers to know that you know your role. You are the expert on your experience and you are doing what you can to continue to navigate and learn for what's needed. This ties into expectations of the caregiver role being versus what you need realistic to do your job. Again, why did you become a caregiver? What's important to you about that? What training or learning might you need? And knowing it's okay to ask and consent for that help because it allows you to be the expert and do the best you can in the ways that you can with this fine balance, right? When it's difficult, go to those problem solving techniques. It might feel silly at first, but when all of a sudden you find out that you're on plan D because you're working through so many things, but that you already had those backup plans in place, it makes it not as stressful day to day, which can prevent that burnout. Remember too that caregivers can't pour from an empty cup, that it's important to make that time and space for you so that you can connect to your caregiver in a meaningful way. Like I said, the care and love you give somebody else is only as good as the care and love you give yourself. So how are you making that time for you? And if you're feeling burnt out, recognizing that's okay and valid as well, that your efforts are still purposeful, and that recognizing if you are experiencing burnout and stress, that it's one step to feeling more like you and that help is available. The other piece, that wellness is not all or nothing. And when I want to share, like I just had in the last slide, that it can look different day to day based on your needs. That you can fit things in as it feels appropriate for you as a caregiver. You can participate in these things with your loved one, and it's okay to make that time and space for you. I also want to add that I spent a lot of time talking about burnout, different types of distress, and the long-term impacts. And I want to recognize that in recognizing the care you need, it's also recognizing when you might need additional help that is more professional help in seeking a therapist. And so the difference between burnout and the distress like anxiety and depression, like I shared earlier, is when the anxiety and depression is defining your experience overall or more often than not. More specifically, the distress you are experiencing is impacting your ability to go about your day-to-day life. And so that's when it would be helpful probably to seek psychotherapy or a counselor. And I encourage you to check with your insurance to see what options are available for you in network. Otherwise, burnout, stress, like I said, we don't want to over-pathologize someone's experience. We want to recognize that these are very valid and common experiences for our caregivers. So how can we support them via the avenues explained today? Other areas I wanted to share that have just been helpful is lots of helping hands. So this is a platform that allows individuals, it's a private group and it's online and it has a calendar and it allows you to plan for specifically designed needs. It can also be with appointments, ride sharing, meal planning, and it allows people to sign up for those things and see the other cares involved, so that a caregiver might have a better idea of when tasks are delegated, or maybe they're leaving for vacation. So figuring out how things can be planned while they're away. It can also be helpful just for caregivers to utilize to help them keep track of things and communicate changes coming up. Other resources helpful are the National Center on Caregiving. This includes group options that are available for caregivers at national, state, and local levels. The EDRC also has supports that are available, including in-home options if feasible, some legal pieces if needed, and financial planning. The last piece I want to share with you all is the online blogs. One of my favorites is with the Mayo Clinic. And what I love is you get to hear directly from other caregivers, specifically any questions they have, and provide any support as a caregiver you may have about things that worked well for you, things that didn't work well for you, or resources that are available that other individuals might not help. And this can also help individuals find the expertise and meaning within their caregiver role as well. All right, and with that being said, now we'll move on to the Q&A portion of the presentation.
If you have any additional questions to the audience, you can feel free to give us a contact here at the National Kidney Foundation of Wisconsin, and we can, help give you the resources that you need to find answers on your questions. So other than that, thank you so much, Dr. Meyer, for sharing your expertise with us today. And I just want to say take care and good night to everybody here today. Thank you so much.